So this is a good time to tell us who you are.
Absolutely. Grew up in a small town in western Michigan, town of 7,000 people. My dad was a dentist there, involved in his extra time in school boards, president for 30 years, started a community college, and I came off to the University of Michigan. Graduated from med school when I was 23, worked my way through med school, worked in a factory, UAW in fact, for 2 years during the summers. And since I graduated, I've been involved in medical practice full-time, never had any involvement in politics whatsoever, never had any plan for that. It's come up fairly suddenly just due to the times that we're in, and so kind of off we go.
Now this is the ultimate, politically speaking, David and Goliath story. I mean, here's a guy with zero political experience against probably the most experienced politician in America.
Absolutely. He is the longest-serving member of the House of Representatives in the history of the United States, and of course he took over for his father, John Dingell, in 1932. So there's no question, you know, John Dingell, my opponent, has been in Washington, D.C. since he was 7 years old, and so he looks to Washington to solve problems, and I think, you know, people are looking for something different now. You know, I think they're worried about their kids and their grandkids and the spending that's going on, and they understand that, you know, they need to look to themselves, their communities, and create solutions that are going to take care of the problems rather than looking for someone else to solve them.
Interestingly, one of the benchmarks of Mr. Dingell's last 30 years was health care, getting health care passed. Now, even he admits what ended up getting passed isn't perfect, but it's a start. You're a doctor. What do you think about this?
Well, the current bill as passed is an absolute disaster for everyone. It's a disaster for the patients. It's a disaster for the employers, for the budget, for the doctor-patient relationship. It's really a mess, and it needs to be removed and started over. We have lots of problems in healthcare. There's no problem. I'm obviously, you know, intimately familiar with those, having been in practice for about 25 years. And so there are solutions that are required, but virtually everything that's in this bill makes most of the problems worse. You know, there's underfunded mandates to the states that can't be paid for, Medicaid rolls exploding, no providers to provide for the Medicaid patients. That's going to be one of our biggest challenges. And the more the government gets involved and the more insulation there is between the payer and the user of the services, the cost will continue to explode. So we need to start over. And there's absolutely no reason we should have any bill passed that hasn't been carefully read and considered by the people who are voting on it. And that's a big issue right now.
I noticed that you are a flatter tax advocate. What do you think about taxing and spending? Where do you stand on that?
Well, the big problem with the tax code right now is it's so complex, and so anything that will help make it easier to comply would be a big move forward. You have so many people spending so many times and resources trying to you know, figure out how to do it. You know, we definitely have some issues there. But we definitely should not be raising taxes right now. That's a disaster for our economy. We have, you know, the government proposing a $50 billion bailout here and there or stimulus. And the reality is that business owners and companies are sitting on $900 billion in cash waiting to be deployed to do what they're expert at, which is hiring people and growing their business. And they don't know what to do. The regulations are out of control. They're talking about tax hikes. They're conserving capital. I mean, all you have to do is look at the health care bill as a great example. In my field of interventional cardiology, the changes over 25 years. I don't do a single thing today that was invented when I started. And so already they're laying people off. They've got this new tax on research and development, on technology, and all of these things are just completely the wrong direction to go.
So as we've mentioned, John Dingell has been reelected over and over again. Do you think you have a chance to win?
Well, absolutely I have a chance. I mean, the time is right. People look at career politicians as not a badge of honor right now. And all you have to do is look at the results. I mean, if you look at Southeast Michigan, we have, you know, Congressman Dingell and Conyers, the two longest current-serving congressmen in the history right now, or in Congress right now. And you know, Detroit's gone from number 1 to number 68 in per capita income under their watch. We've lost 5 congressional seats next year, effective, maybe 6. And, you know, the auto industry's collapsed. You know, Thomas Friedman from the New York Times says that John Dingell is the single legislator most responsible for the collapse of Detroit. And so I think there's results. You know, when I'm in the middle of the night seeing somebody with a heart attack and things aren't going well, you say, things aren't going well. I'm trained to recognize the problem, find the correct solution, because the outcome is there. And career politicians, they're more interested in getting reelected than they are solving the problems. Their job is to kick the can down the road, leave it for someone else, and get back into office. And that people don't want that anymore.
So you can restore the heartbeat of Michigan.
Fantastic. I like it.